There are several things that make training at MedStar great. The first is the remarkable diversity that we have in patients. The second is our remarkable group of faculty and program directors. They're invested not only in the teaching of our residents and fellows, but also mentoring them so that they can be well prepared for what happens next in their careers. And finally, our amazing GME team. They work together to make sure that we are caring for our residents, not only as a system, but also at the individual level.
We are one of the largest GME training platforms in the country. So we have over 95 residency and fellowship programs, close to 1,200 residents and fellows throughout our system, well over 1,500 teaching faculty, a strong partnership with Georgetown University, and also an embedded research infrastructure in our partnership with the MedStar Health Research Institute within MedStar.
I think the biggest advantage that MedStar offers to our trainees is the diversity of programs. There are opportunities for our trainees to go to different hospitals, to meet different people, and to interact with faculty, students, and each other in a way that really will broaden their horizons and strengthen their training as they move forward.
Each hospital has its own environment, its own subset of patients, but they're all united under this common MedStar goal of taking care of our community. It almost has the feel of like your neighborhood community hospital, but it brings with that kind of this academic powerhouse, but it allows you to feel comfortable while also feeling like you're at the forefront of what's happening in medicine.
It really gave me the best of everything. I think I made the right choice by choosing to come to MedStar, and I'd actually really like to stay on as a fellow for further training because of the unparalleled opportunities.
We understand that you work hard in residency, but we also want you to be well.
We understand that life continues to happen, even though you're in training, and we want to make sure that you're able to live your life and get the training that you need.
The MedStar Working Group for Racial Justice is an initiative by the Graduate Medical Education Office at MedStar to basically look at some of the issues around race, equity, not just for physicians and staff, but also for patients who come to our hospitals.
Our goal is to try and increase both awareness, opportunities, and ways that we can deal with issues of racial injustice, health equity, and health concerns for the populations that we serve here at MedStar.
Georgetown University Medical Center has a long and proud tradition of medical excellence in academics and in our community that we serve. And at Georgetown, we take a lot of pride in our hospital, in our interactions with the community around us, and our partnership with the university and the medical center.
So there are a tremendous number of opportunities that are available for residents and fellows. We're comprised of over 300 different investigators, and nearly every investigator is always looking for a helping hand from really bright residents and fellows.
The global health track is something that really stands out to me at MedStar. When I was interviewing at different places for my residency, it's an invaluable opportunity where you learn how to take in the different cultures, and you learn how to take that information and realize that you're not going on a global health trip to bring Western medicine somewhere. You're going to teach and to learn.
MedStar created a Residents as Educators program really to help foster your growth as a resident. We really want to provide the skill set that you need to become an expert clinician and to be able to be a lifelong learner, but also a lifelong educator.
When residents are here at SITEL, we always set the stage for psychological safety. This is the time for them to go ahead and make your mistakes. It's okay. Then, when you see it in real life, it won't be brand new to you. This is an opportunity that not every other training program has. It's a pride, it's a jewel for us, and we want to be able to share that with you.
COVID has definitely created some disruptions, not only in the healthcare space, but also in the education space.
As a system, we were privileged to care for more than 3,000 patients with COVID-19 infections. MedStar Health did several things to ensure the safety of every associate who was taking care of patients who were infected with COVID-19, starting with making sure that we had enough PPE, but also making sure that residents and fellows knew how to use PPE. They offered many didactic sessions so that we could better understand this disease and the management of patients with it. And finally, MedStar conducted several town halls in which we were able to have bidirectional communication.
I think that there's no better place to do your residency training than at MedStar Health. You really get the best of both worlds: intimate, top-notch education by faculty who really, truly care about being educators and about our patients, while at the same time being part of a huge health system with a great number of opportunities.
Once you finish your training in a MedStar Health program, you will be well prepared to face any challenge that you see in the future.
That's something that I continue to hear from senior residents, from faculty, that they feel like anybody coming out of this program is equipped to handle anything that walks in the door. And I feel that's really strong training that you don't just get anywhere.
Our motto is Cura Personalis. This is a Latin phrase that means care of the whole person. And while we intend this to apply to our patients, it's so much more. It's how we care for each other as faculty, as students, as residents. If you come to MedStar, you'll experience this sense of being cared for completely.